So HIV is the human immunodeficiency virus. It's a virus that can cause AIDS. It's transmitted with direct contact through certain body fluids, so blood, semen, vaginal secretions, and it can be transmitted through breast milk. HIV falls into the group of retroviruses, which are very challenging to overcome because they actually get into your body and they integrate with your own cells. They use your own cells and take them over and use them to replicate. So it can be a little bit difficult, particularly with HIV, because it binds to the T cell receptors. So your T cells, your CD4 cells are your helper cells, your white blood cells that are the first line of defense when you have a foreign pathogen or a bacteria or a virus introduced into your body. The T cells are what throw up the red flags. Hey, we need help. Something's coming. We have to get going. So when it takes over those cells, not only does it use them to replicate, but then it reduces your immune response. And over time, that impacts a person's ability to fight off even simple infections. Everyone is at risk for HIV. Certainly the highest populations that we see new diagnoses in are Black and Latino men that have sex with other men. But it's important to note that 50% of all new diagnoses were in age 50 and older. And out of that, 20% of those new diagnoses were women.
Through bodily fluids, blood, semen, vaginal fluid, anal fluid, and breast milk, and through how it isn't transmitted. It's not transmitted through tears or sweat or hugging, skin-to-skin contact. You don't get it through saliva. You can't get it by drinking from somebody else's soda glass or from eating off of somebody else's plate. You can't get it from sitting on the same toilet seat as somebody else. All of these things that we used to think were potential concerns and that are still out there in the mindset about concerns. So it's educating on what this is and isn't, how you can and cannot get it, why it's easier to get if you are someone who's exposed to these bodily fluids through more porous parts of your body, membranes in your body that are more likely to absorb fluids like the Bounty, quicker picker upper paper towel absorbs things. And how if you're just like shaking hands with somebody, you don't need to worry about it.
Now we have multiple 1 pill a day regimens. So as before, where patients were having to dose multiple times a day, they were having to adhere to difficult food restrictions or worry about drug-drug interactions because they were on so many different medications. Now it's 1 pill once a day. We also have more specialized testing that can help us use correct medications right from the start. The days of trial and error are not completely behind us, but we do much better. And then coming on the horizon, we've just had a new medication, an antiviral medication be approved that we've started rolling out here at the clinic that's an injectable. So patients come in after a loading dose, they come in every 2 months, they get an injection, and that's their medication. There's no more pill bottles. There's no more daily reminder of their HIV. They're just living their lives.
When people are on the medications that we have today, and they're taking their medication every day, the amount of virus in the body goes so low that tests can't even detect it. We only know it's there because if people stop taking their meds, we start to see that the virus rebounds. When you don't have any detectable virus in your body, it is impossible to transmit this through sex to other people. It's a lot less likely to transmit this through blood. There's conflicting data about breast milk. So for women who are pregnant and want to breastfeed, we really recommend they have a long talk with their doctor about that. Take your medicines and check in with your doctor so that we can make sure everything's working the way that it should work. And that's the most thing, then live your best life, be as healthy as you can. Make sure you're taking your meds every day consistently, and make sure you're checking in with your doctor.
Now we see patients aging out, right? And we've never seen that before. We've never seen long-term survivors getting to be old enough where they start to have aging out issues, geriatric concerns, cardiac issues, high blood pressure, cholesterol, normal things that come with aging. But then what does that look like in the setting of HIV? So that's our new challenge now, is what does that look like and how do we best care for those patients? But what a great place to be, from where we were 40 years ago, where the average life expectancy after diagnosis was only a couple years. And now we have patients who come in and say, yeah, I was diagnosed 40 years ago and I'm here and I'm healthy. And so that's really wonderful. It really speaks well to how far we've come. They're just not thought of as high risk. Many of them are in monogamous relationships. So they're not tested as often. Some of them, older Americans, came up through the stigma of HIV. And so stigma can be a barrier to care. People are uncomfortable speaking to their provider about it. Providers are sometimes uncomfortable speaking to patients about it. I'm in New York State. We have a mandate that says providers need to offer HIV testing at any visit. And I go to my own physicians and they don't offer. And I say, well, you didn't offer me that. And they say, oh, did you want it? I didn't think that you would be at risk. Everybody's at risk. There are certainly more high risk groups, but no one is excluded. We have patients that come in who contracted HIV from their very first sexual encounter. We have patients that come in who contracted it from their long-term partner who they thought was monogamous. So unfortunately, everybody is at risk. And early detection, early treatment is key. So we need to be comfortable pushing back, asking our providers, hey, could I be at risk for this? Do you think it's worth getting an HIV test? I would like to get an HIV test. We're also seeing, higher divorce rates. So you see more people in their 40s and 50s and 60s getting back out there, being sexually active. And because they're not as worried about pregnancy, they tend to be less likely to use condoms. And that in and of itself, can be a risk factor. Older women are, hormonally, once you go through menopause, you do experience some vaginal dryness. It can make those tissues easier to rupture, therefore allowing the virus to pass easier. So there are some risk factors for older people that I think sometimes we don't think about, but they definitely exist. I think education is probably the biggest thing that most of our patients need coming through the door. They need to know that they're safe, that they're going to be okay. And then they need the education as far as their disease, what to expect, how to properly manage it. And we do a good job on assessing people when they come through the door. Do you know how to make an appointment? Do you know when to call for a refill? Health literacy plays a big part in what we do. And we find that patients come in lacking a little bit of that. So to support them in that and helping them understand the disease process, how their medications work, helps them take better control of their health and ends up with more positive outcomes for them.
Learn what this is and how you can know that you're the one in control of it, that you're the one who has a handle on it, that you have every resource in and of yourself to be able to live a long, healthy, full life, and that this disease is, it's not even a disease. This virus in your body is not going to take anything away from you that you had the day before you got your diagnosis, or any dream you had for what's going to happen 30 years from the time you get your diagnosis. So many providers are making assumptions about who is and is not at risk for HIV, that people are going long periods of time without ever being tested. Some of the people who are lucky enough to find out early on enough to get right on top of this almost as soon as they're exposed are the people who already come to the table with the knowledge that I want to get tested for something. But a whole bunch of us don't know. I can say 100% as a white cisgendered woman, I would never have been perceived by a doctor to be somebody who'd be at risk for this. And I probably would have been really sick and had to have worked really hard and possibly had long-term impacts to my health had I not happened to donate blood at a campus blood drive to find it back there in 1991. The fact that doctors make assumptions, or I think sometimes they feel like they might be insulting a patient if they say, would you like to have an HIV test? They don't want to like say, I'm thinking something about who you are or might be by offering this to you. And so that stigma from the very beginning prevents diagnosis and immediate treatment, which is the absolute best thing for this. The person that you love with HIV, the person you're caring for with HIV is the same person they've always been. This has not changed them. They're not a different person. They are going to have every single fear and dream and hope and need and annoying trait and wonderful trait that they've always had. This is a virus. It is not a personality change or a total do-over of the person's life.
I think the most important thing to tell them is you're going to be okay. This disease is manageable, and you are worthy of managing it. You just need to stay on top of it. And then tell them that I love them and probably hug them really tight to just let them know, you're safe and you're not infected or diseased. You are worthy of a cure, and we're working for that. So I think I would just tell them that they're going to be okay.
You're going to be okay. You've got this. You have everything in you to be able to take care of it. And I'm here for you, and I will always be here for you.
Absolutely take your medications and keep taking your medications. HIV can be a very smart and cunning disease. It can mutate, it gets smart, it can evade certain medications after time. So the best way to combat that is strict adherence to your antiviral regimen, which also has the added benefit of keeping you virally suppressed and limiting the damage that the virus does to your body.
You are not the virus. This virus does not define you. You control this virus. You are in control of it. It's not in control of you. So don't think of yourself as a walking virus. You are a person who is living with HIV, and take your medicines every day, all the time.
Trust your own instincts. If you think that you're at risk or if you think that something is wrong, say that. If you feel that your provider is not taking your concerns seriously, maybe you need to think about switching providers. We need to normalize HIV testing. It needs to become part of everyone's physical every year, because as I mentioned, there's truly no one who's not at risk in some way. So I think if we can normalize that and make women comfortable talking to their providers about that, it will go a long way in diagnosis and treatment for those women.
Every year when you go into your doctor, ask to be tested. Ask to talk to your doctor about what risk factors are if you don't know. If you have an encounter where you think you might have been at risk, if you have unprotected sex with a new partner, if you start to feel like your glands are swelling, or all the other symptoms that you can talk to your provider about and learn, and you don't know what might be going on with the partner, or even if you think you do know what might be going on with the partner, ask your doctor. Ask if you could. Rapid tests take 15 minutes. You can get an answer, and that's your beginning point. They're very accessible, and it's so much better to know this right on, as hard as it may be or scary, to know it right away so you can get on treatment right away if you're living with this. And if you're not, you have the relief of it.
I've seen it in many facets. Personally, I've seen it growing up with my mother being ill. We had housekeepers that hit or quit. We had family that kind of turned their backs. Someone in our local PTA had gotten wind of my mother's diagnosis, and the parents actually held a PTA meeting to see if we were safe to attend school with their children. So it was really ugly back then, but I still see some of it today. It's family members who don't understand what HIV is. So their family member comes to them with a new diagnosis and they're shunned. It's providers, it's patients who can't find a dentist because particularly with dentists, there seems to be a pervasive kind of misinformation about what is how HIV is transmitted and how at risk they are. And that seems to be a big thing for our patients. It's just finding a dentist. They can't find one that will take them because they are stuck in that 1985 thinking of how HIV works.
There has been a lot over the 30 plus years that I've been living with this. Um, One of the reasons that I get my own care at a HIV Ryan White clinic is because I know that when I go to the doctor, people already know why I'm coming there. They know what my story is, and I don't feel like I have to worry about people recoiling or rejecting or being afraid to treat me.